Yes. I am Dr. Sharda Jain. Today I'm going to speak about breast cancer management update for general practitioners and for gynecologists. It's irony that all patients come to gynecologist breast cancer treatment, because for counseling, basic knowledge is very much important. Breast cancer is now the most common cancer of women in our country, is the first leading cause of cancer in women, and a girl born today have a cumulative rate of 1.8 risk of developing breast cancer during her lifetime. Every 3 minutes, a woman is detected to have a breast cancer. So today I'm going to tell some of the facts which every practicing person should know other than the breast surgeon. According to the WHO, the breast cancer is among the leading cause of morbidity and mortality worldwide among women. Approximately 14 to 15 million new cases are seen, and half of them die per year. It is expected that the new cases are going to rise by about 70% over the next 2 decades, and the deaths from breast cancer will amount to 500,000. Breast cancer in India, the incidence is around 111 per lakh. It tops the list of the most common cancer in a woman, roughly amounts to 28 to 30% of all cancers seen in women. It is predicted that the breast cancer incidence will be more than quadruple during the next 20 years, and average age is 48 years, and 50% of them consult doctor late, that is in advanced stage. A woman who is 80, the risk of dying of breast cancer is 1 in 8. The woman at 50, it is 1 in 50. For 40 years woman, it is 1 in 200. For 30 years, it is 1 in 2,500. Family history of, if it is there, BRCA is BRCA1 and BRCA2 is present in 10% of cases. The people who have a late menarche, people who have an early menarche, people who have a late menopause are more prone to breast cancer. The people who have a childbirth late, people who do not breastfeed their children, the incidence is high. So the risk factors are that woman who does not have children, who have not breastfed, who had been on HRT for more than 10 years, obesity is seen associated factor in 30% of patients, people who have alcohol, nearly 10%, it is seen, the history is there in those people who have alcohol or smoking. What are the clinical presentation of breast cancer? They usually present with a lump in a patient more than 30 years. Skin changes are seen, which are puckering, dimpling. Sometimes more skin distortions are there in the form of a nipple eczema, which is seen in Paget's disease. The nipple can be retracted or can be distorted about roughly in less than 3 months' time they have seen, or they can be unilateral bloody nipple discharge also. So patient can present with a lump, they can be nipple inversion, they can be dimpling, they can be puckering, they can be a bloody nipple discharge, they can be an eczema, and the patient is using different kind of medications for this particular, and there is a variety called inflammatory breast cancer. A breast lump and a breast mass is seen is a positive predictive value. Positive predictive value, anything more than 3 has a good chance, and for a breast mass and a of a breast cancer, you find that in 90% of breast cancer, it is incidental. Only in 10% of patients, you can find that it is familial. Significant family history we call when 3 or more relatives are there. One first degree, young patient, or who have had ovarian cancer is plus minus. Average risk is one second and a third degree relative, and a moderate risk is when a woman is in between the significant risk and the average risk. Counseling for a breast examination is very much important. Annual mammography is suggested for after the age of 50 years now, and that should be done every 2 years. But the people who are BRCA carriers, in those cases, they can get it done earlier. The people who are earlier than 30 years, 30 to 50 years, they can have an annual MRI mammography done. So these are the modalities which have been there. Mammography has a pickup rate is much better than the self-examination. BRCA, the breast cancer risk increases to 80%, ovarian cancer risk rises to 50%, and people opt out for a couple of things. They require surveillance throughout life. Some people go for chemo prevention in the form of tamoxifen or raloxifene, or risk-reducing mastectomy with immediate reconstructions can be done in such patients, along with laparoscopic oophorectomy. Now, as for the breast cancer is concerned, the surgery is the mainstay of the treatment. You should send them to the center which has a multidisciplinary team, person where there's a surgeon, oncologist, radiologist, pathologist, breast care nurse, and geneticist. Now it is possible to have a breast conservative surgery. These are the patients where the things have been picked up by breast examination, or the screen detected breast cancer. When it is very early, one can definitely have a conservative surgery. In such cases, things have been very streamlined, and a person who is willing to retain her breast, it can be done without much loss. It is seen that the highest achievable cure rate is to the tune of 95%. It definitely requires post-operative radiotherapy, but no difference is seen otherwise. There's small tumor relatively to the breast size is there. Now, mastectomy, many people, is the patient preference. They want to get rid of the breast with a tumor, especially when you find that the breast size is significant or it is a multicentric breast cancer. One can do various kind of surgical treatment, from simple mastectomy to skin sparing with immediate reconstruction, skin and a nipple sparing with immediate reconstructions. This is a breast reconstructive surgery, which is now, I think, is being specialized in one of the advanced cancer centers to see that the modesty of the woman is retained. These are the various kind of reconstructive surgeries which are there now available for a breast cancer patients. They have definite indications, right from the implants to the plastic surgeons getting involved into it, and they do a great job. Now, sentinel node biopsy brought a revolution because it is the first lymph node that drains the breast, and if it is positive, then they can decide about it, what kind of a surgery need to be done in such cases. And then a dye is seen at the time of surgery, and very simply, this particular technique has been structured very well to see the conservative surgery can be offered to these patients without loss of any compromise as far as the treatment is concerned. Now, people talk about the adjuvant therapy, which all of us must know about it. A long-term risk of breast cancer recurrence remains high, and adjuvant therapy, chemotherapy to give or not to give, is a big decision. Adjuvant chemotherapy or hormonal therapy reduces the risk of distant metastasis by approximately 30%. However, 70 to 80% patients receive this treatment would have possibly survived. They have a long survival. Radiotherapy is given following the breast conservative surgery or following mastectomy if the tumor has been larger than 4 centimeters, or there is a heavy axillary lymph node involvement, more than 4 nodes are involved. As for the hormonal treatment is concerned, 80% of the breast cancers are hormone receptor positive, and they will benefit from 5 years hormone treatment, and they have an extra benefit of protecting the contralateral breast Available hormone treatments include tamoxifen and letrozole. The guidelines for the breast cancer adjuvant hormone therapies, if patient is premenopausal, it is given for 5 years tamoxifen. Postmenopausal, roughly also it is given for 5 years. The guidelines for the treatment of breast cancer extended adjuvant hormone treatment beyond 5 years are, there are many additional drugs are available now, and depending upon whether the node is positive, what is the size, they can even go beyond 5 years. How to improve breast cancer survival? The breast screening is very important. Self-breast examination must be taught to everybody. The pickup rate is not as good as mammography screening. They should go for an annual checkup, and when there is a family history, they should go check up twice a year. Lifestyle changes have to be done drastically to reduce obesity, because obese people have 3 to 5 times more chances of cancer. There must be created awareness about the hormone replacement therapy, smoking, breastfeeding, how it is protective for breast cancer. High-risk family history of a woman should be known, and they must be told about that. Screening with BRCA1 and 2 is positive now, and then they can have a chemo prevention with tamoxifen and raloxifene, and they can have a reducing mastectomy for the same. As for the summary is concerned, the breast cancer is the commonest and increasing in incidence in India. The women are more likely to present at an advanced stage in 50% of cases, and this has to be cut down to much less to have a better survival. Every woman should be told about the breast breast cancer awareness, and they should come forward for a regular screening with mammography, as well as from the age of 40 years onwards, every 2 years. Now the consensus is building that not at 40 years, it should be done at 50 years. Public health awareness efforts should be intensified and directed towards women. The awareness must be created in families where there's a history of breast cancer in the first and second degree relative, and they too take too casually, and this is one group where the chances are more.